Hi, I'm Jenny Lee, and I'm a student nurse here at Lock Haven University, and I'm doing a video on diabetic foot care. And it's very important to me because it has affected people in my family, and I think that it's very important that we teach our patients with diabetes about taking care of their feet. So the three main points that I'm going to talk about is the effects of diabetes on your feet, how to inspect your feet, and prevention. This is Amy and her sister Caitlin, and we're going to discuss the effects of diabetes on the feet. Well, Amy, with your new diagnosis of diabetes, we really want to make sure that we discuss some of the effects that can occur with diabetes on your feet. So I did want to start out by letting you know that there are a few things that can happen with nerve damage. So with the nerve pathways being damaged, you could end up with some numbness, tingling, decreased sensation. You could have pins and needles. We just want to make sure that you're real aware that these changes do occur with the continuing of the diabetes. Another thing that can happen is blocked blood vessels. So your blood vessels can sometimes get an occlusion in them where that decreases the blood flow, and if something happens to your feet, like you get an ulcer or a sore, it can really diminish the amount of time it takes to heal. Another thing that happens is you can get weakened bones, and this causes like a shift in the foot. So the bones can get a little bit weak, and the joints can also collapse, and this predispositions you to having some foot problems later on in life. Another thing that can happen are blisters and calluses can occur due to the pressure points changing in your feet, and we want to make sure we try to prevent those the best that we can. And one of the bad things that can occur are ulcers or sores. So that's kind of a big problem whenever the layers of the skin start to break down, and we really want to try to prevent these things. But with having diabetes, it does have changes in your feet, and you want to make sure that we try to prevent those. Next, I'm going to show Amy and her sister how to do a foot inspection, and this should be done daily in order to prevent foot ulcers and breakdowns. Amy, I'm going to go ahead and show you a way that maybe you should start looking for signs of having kind of issues with your feet. So we're going to do a foot inspection. Whenever you do a foot inspection, I want you to be able to take your shoes off, and I want you to look at all areas of your feet. I want you to look at the top part of your feet, the bottoms of your feet, and in between your toes and around your toenails. And of course, you don't ever want to forget your heel. If you have trouble looking at the bottoms of your feet, it's really nice to be able to use a long-handled mirror, and that way you can really see all angles, and it's very important that you see them all. You want to make sure that you're checking to notice any color changes in your feet. If you get bluish toes, the foot gets a little pale, those are signs of decreased circulation. If you start seeing a red spot that has some streaky lines, that could also be a sign of infection, and these are really important things you want to keep an eye for. Another thing that can happen is a lot of swelling in the feet. So when there's swelling, you're going to have increased fluids, and that could lead to having a spot for a pressure ulcer or a sore or blister to start. So you want to make sure that you're watching for an increase in your foot size. Also, you want to watch changes in temperature. If your feet start to feel a little cold, that could be signs that you're not getting good circulation. Or if you're not really feeling like you notice good sensations in your feet, that's also another change. Another thing is you want to watch any hot spots that are caused by friction or pressure. That could be a predisposition for having an open sore to develop. And you want to make sure that you're watching for cracks, sores, ulcers. These things are very common in an ulceration in a diabetic patient, and they're very hard to heal, so we want to make sure we try to prevent those. And another big thing is ingrown toenails. So you want to make sure that you're cutting your toenails straight across, and you're always observing for signs of ingrown toenails to get those taken care of right away by a podiatrist. Now we're going to talk about ways to prevent complications with the diabetic patient. Now, Amy, one of the good things is that you can really try to prevent as many problems with your feet with your new diagnosis as you can. One of the really good ways to do it is really to do walking, swimming, biking. That increases your circulation to your feet, and that's a really good thing to do. And we also want you to try to prevent a heat and cold sensation. So whenever you're washing your feet, you want to make sure that the water temperature is a nice warm, not too hot, not too cold. So you just maybe need to check the water prior to getting in so you don't scald your feet. Another thing is that you don't want to cross your legs. Crossing your legs really decreases the blood flow to the feet, and that could add complications to your diabetes. And you want to try to avoid any use of over-the-counter medications for calluses or corns, because that in turn could actually burn your feet, and with a lack of sensation that really puts you at high risk. And another big one that I'll really stress is you don't want to walk barefoot. And I don't know if that's something that you do on a regular basis, but you want to make sure that you have really good fitting shoes on all the time, and you want to make sure your socks aren't too tight If you're buying shoes, you want to make sure you're buying shoes later in the afternoon so that if your feet are a little bit swollen, you know that how they're going to fit so you don't have any rubbing issues. And the best thing that you could possibly do is to control your diet and your blood sugars with your diabetes. This, if keeping your blood sugars in line, will really prevent further complications down the road. Okay? Now you should have a good idea of patient teaching on diabetic foot care, including the effects of diabetes on the feet, how to inspect the feet, and prevention tips. Now the one thing is you want to make sure that you really have your feet checked regularly by a doctor, and that's very important. Do you have any questions?
I don't believe so.
Thanks for watching.